Hello, everybody. Distinguished Dr. Bojan Boškovski, National Coordinator for the WHO from the Ministry of Health. Distinguished Dr. Jihan Tavila, Head of the Office of the World Health Organization in the Republic of North Macedonia. Distinguished Dr. Joao Breda, Director of the Regional Center for the WHO for Quality of Care and Patient Safety in Athens. Distinguished Madam Federica Secchi, representative of the World Bank, distinguished representatives of the United Nations, distinguished representatives of the Ministry of Health and other state institutions, distinguished colleagues, distinguished doctors and scientific workers, distinguished directors of health institutions, representatives of the NGO sector from the area of healthcare, distinguished media representatives, dear guests. Welcome to the National Annual Meeting, Reform in the Primary Healthcare in the Republic of North Macedonia, taking a step towards better recovery. The Ministry of Health of the Republic of North Macedonia, with the support of the WHO and the World Bank, initiated the national reform of primary health care in 2018. In 2019 and in 2020, two national health forums were held with the purpose to develop the vision for the new model of care in the center of primary health care and to adopt an action plan for the reform process. The pandemic of COVID-19 additionally pointed out the need to speed up the implementation of the reform in primary health care. In 2021, efforts were directed towards developing a professional technical tool for the reform for primary health care in accordance with the national context, and a pilot location was initiated, the municipality of Karpoš, to test these tools. This year, with a bit of a delay due to the COVID-19 crisis, we are proud that we managed to organize this already traditional regular annual event where the focus of the discussion is primary health care. At this event, you, the main national stakeholders, again will meet to assess progress in the national reform activity of primary health care, to integrate the lessons learned from the crisis with COVID-19 and to determine future plans to improve quality of service of primary health care. During this meeting, we will find out details about the progress in the reform of primary health care, and we will present future necessary steps for this reform to be turned into reality. Their own addresses during this event will be given by Dr. Bojan Boškovski, first of all, on behalf of the Minister of Health, Dr. Jihan Tavila, Head of the Office of the WHO in Skopje, Madam Federica Secchi, representative of the World Bank through online connection, Dr. Joao Breda, director of the Regional Center of the WHO for Quality of Care and Patient Safety in Athens. After the introductory sessions, the working part of the meeting will take place where, during a panel discussion moderated by Mr. Tino Marti, consultant of the WHO, there will be participation by representatives of the Ministry of Health, Health Insurance Fund, Health Directorate, and representatives from the Health Center Bucharest. After, we will have a plenary session where you, distinguished colleagues, will have the opportunity to ask questions and to present your opinion on the discussed topics. And one more technical information, we would like to point out to you that if you need to hear interpretation, you can use the headset because the entire event is being simultaneously interpreted. I wish you a successful day, constructiveness and collegiateness in the discussions and exchange of new experiences and knowledge during this topic. We will start with the official opening of the conference. As first speaker today, I would like to invite Dr. Bojan Boškovski to speak on behalf of the Minister of Health and to give a speech on turning the vision for better primary healthcare into reality in the Republic of North Macedonia. Dr. Boyan, the floor is yours. Thank you, Sanya. Distinguished representatives of the WHO, distinguished representatives of the World Bank, distinguished representatives of the United Nations, dear friends, colleagues, I did not prepare a speech today, but I have been participating in this process since 2018 and I will speak honestly from my heart. We, together with the WHO and the World Bank in 2018, started a process of analysis and assessment of the primary healthcare system. And I think that for the first time, such an encompassing analysis was done on what type of services are provided in primary healthcare, what type of services were the weaknesses and where are the benefits. I think that for the first time we have a process in which all participants participate, all stakeholders in the health system, including GPs, nurses, chambers, professional associations, which participate in the creation of a new model, a new vision, which I hope will turn into reality. Until now, for the first time, we're speaking about the influence of the nurse in primary healthcare, about increasing the services on the level of primary healthcare and making the system available for everybody. Many digital tools were introduced in primary healthcare which make it easier to work for the doctors and make the service more available, more quality and faster. But if we can do even more, I would like to thank the WHO for the support once more. The reform of primary healthcare, I feel, maybe had a delay due to the COVID crisis, but the COVID crisis also contributed so that we can learn even more and increase the services and increase or change actually the way services are provided in primary healthcare. For the first time, telemedicine of primary healthcare was introduced, which is something new in a state of crisis, and we feel that this is a contribution that we can keep enjoying. Also, for the first time, we have electronic prescription in primary healthcare as a consequence to the crisis, but it is something that was planned even before the start of the crisis. And I want to say that many things and many people that were skeptical before the start of the crisis, whether some things can be changed at all. And we saw with the crisis that we had to change them and that it is indeed possible to change them. Even though the reform maybe was a bit slower and did not meet many people's expectations, the idea has not stopped completely. We see that changes are happening and we hope that in the future we will have a true change and this will be beneficial to the health workers and also for the users of these services. Once again, I would like to thank you for your presence. I wish you a successful working day, a fruitful discussion, and I truly believe that the basis of the healthcare system is primary healthcare, and without a good and efficient primary healthcare, our health system will not be developed further. Thank you. Thank you, Dr. Boyan, for your address. And now, Dr. Jihan Tavila will address you, head of the office of the WHO in Skopje, in the Republic of North Macedonia, on the topic primary healthcare during and after the pandemic. What did we learn? Dr. Tavila, the floor is yours.
Good morning. Thank you very much for being here. I do welcome you all. Dear friends, dear colleagues, dear UN colleagues, dear World Bank colleagues, dear members of the steering committee, the National Steering Committee for PHC. I haven't seen you for some time, and this is because of COVID. But now that we are here, we are still pursuing our goal, and our goal is a better primary health care, because we believe that a renewed primary health care in North Macedonia is going to be the best gift we can give to the health of the people, our people in North Macedonia. I just want to bring to your kind attention that last month, maybe I need some water. Last month, WHO has released the WHO Financial Protection Study. Thank you, Sam. Sorry for that. So I was saying, WHO released the financial study on protection. That means about how much we are protecting our people from bad hardship related to expenditures in health. And what was found out, that the out-of-pocket expenditure of the households, of the people, they pay from their pocket approximately 42% on health. Now, what does it mean? It means that financial hardship can be a problem, and not only in North Macedonia, but also in any country. So out-of-pocket payment may not be a problem for those who can pay. And if it is small, it might not be a problem. However, it is a big issue for those who cannot pay, for those who belong to the poorest of the communities, and also there is not, in general, enough money to pay for medicines and to pay for hospitalization and other things. 42% is high. So as a result, what should happen? What will happen? The healthcare, the access to healthcare, seeking healthcare is going to be reduced, and health status will be undermined, and also the poverty is going to deepen, and health and socioeconomic inequalities will increase, and we do not want that. North Macedonia, from the time I arrived to this country 4 years ago, and a little bit more, has adhered fully to the universal health coverage principle, to the Sustainable Development Goals. And we have seen the idea of a new primary health care system, or let us say a readjusted primary health care system to the needs of the people, to the changing socioeconomic and demographic situation, to the transition of this country, has emerged in 2018, as we have heard from Sanya and also from Bojan. And North Macedonia was the first country to adhere to the Astana Declaration on PHC. You remember, 2018. Very quickly, in February 2019, we worked hard to collect all the information, but what has happened in early 2019? Everybody, stakeholders, partners, technical colleagues of the health sector have come together to design, to have a vision together about a new primary health care situation in the country. And I can tell you, dear colleagues, you have done the right choices. Most of you have been here since 2018, walking with us this road. Now, 3 years on, what do we have? 3 years on, your presence here, and those who are following up also by the streamlined presentations on the web. 3 years on, your presence is a token of continued commitment and also of recommitment after the lessons we learned from COVID-19. COVID-19 has been a burden. It has been a great problem for the country, but a big lesson learned. What did we learn? We learned that we can be agile. We learned that we can find solutions that work for the people in the most difficult situations, where people could not go to the healthcare facility. And you, the health system people, the health providers, and I look at my friends from family medicine and the primary care, you have found solutions. Medicines have been available through e-prescriptions. Can North Macedonia do reform? Yes, you can. That's my conclusion, and I hope you agree with me. So, COVID was a massive stress test for your system. And frankly, you passed with the flying colors. So why not, in between the crises, we cannot do something to make the services closer to the people through a fit-for-purpose, well-organized, good providers to bring in health to the people. So, after 4 years and a half being your WHO representative to your kind country, beautiful country, and with beautiful people, I believe that you can make a difference. I also believe that the vision that you have decided on in 2019 and the action plan that you decided on in 2020, at the start of the pandemic, we were meeting here in this same place, and we decided what is the plan of action. It hasn't been possible to go through all the details of the action plan. But mind you, maybe this is not bad, because COVID has shown us the way to get quick, to get new ideas and to introduce them into our system. We also have experienced something beyond e-prescription and the other things. We have experienced clinical leadership, innovative leadership at the facility level. Primary healthcare physicians find solutions. You are the treasure of this country. We have learned as well that one party cannot face all the challenges of healthcare, either in crisis or in non-crisis. Working together is very important. And I just want to tell you that North Macedonia is an illustration of the new WHO working plan, which is the WHO European Programme of Work 2020-2025. So you can be a fantastic showcase about how working together we can make a change. And mind you, the title of this WHO plan that is very close to the heart of my regional director, Hans Kluge, who has been all the time with us supporting PHC, is United Action for Better Health. Don't forget this. If you don't come together and find a common ground of agreement of what needs to be done and put the patients in the center and try to go to the low-hanging fruits, what can we achieve now? What can we achieve later? What can change that can make a difference, a visible difference for the persons in this country? Then we can show that together the health sector is the basis of the health and wealth of North Macedonia. So all I want to say is that you were right. You were right in your decisions. You were right on the right track also in your actions. And I truly congratulate you for where we are. We were a little bit delayed, but time is not very important in the sense that we are building for the future. We still have many things to do, and we are building for the future. I just want to say that we, as WHO, and I'm sure my colleagues, we have UNICEF with us today, World Bank is with us fully today. We are committed to your PHC vision. We are committed to make your plans a reality. We are committed to make every single member of the health workforce, nurses, primary healthcare physicians, specialist family physicians, we are committed to facilitate everything possible to make them play their full role for which they were trained. We will continue to advocate and technically support you to better financial protection. Don't forget, it's an important element of access to care. Better access to positive medications. Please voice up your concerns. Controlling non-communicable diseases. Promoting health, and mainly, I would like to see you, the health sector, working with the education sector to make a very good health-promoting schools. We would want to see better adherence to vaccination, dissipate the misinformation, and double the rate of mask wearing. Now, I took it off just temporarily, but I'm going to put it, and then we will be using a lot of alcohol to clean up. So, double mask wearing indoors. This is the latest recommendation. And fight communicable diseases by vaccination. It's the only cost-effective way to control the outbreaks and also other communicable diseases. So, the end of the year is approaching, and the festive season is here. And for that, I would like to wish you a lot of good things with your families and enjoyable time and celebrations. Don't forget the basics. Keep distance, put the mask, get your vaccination, the primary series, and also get your boosters. And I know I'm preaching for converted people, but still, talk about it around you. But what I want to say is that if I want to give you one message before I close my little speech, is that we have to move from being reactive, from reacting to problems, bits and pieces, to more a mode of stabilizing the system. And this you can do. Because we are in business of health. You are in business of health, and you can make a difference. You can make the people's life better and healthier. And that means building an efficient, fit-for-purpose, well-performing primary healthcare system, and I am confident that you can make it in North Macedonia. I thank you very much, and thank you for all who have really made our day possible, the PHC committee, Mr. Bojan Boskovski, and also His Excellency, the Minister of Health, Mr. Filipci. Sorry he's not with us today, but he sent his regards and his apologies. He has a parliamentary session. So thank you very much, and I'm eager to listen from you on how we can move forward. Today is the turning point to make the decisions and the commitment. So thank you very much for listening to me. Thank you.
Thank you, Dr. Zhihantevila, for your speech. Now, Mrs. Federica Secchi, representative of the World Bank, will directly address you from Washington regarding the partnership of the World Bank and the Ministry of Health for development of the primary health care in the Republic of North Macedonia and the path for future steps. Mrs. Federica, the floor is yours.
Can you confirm you can hear me, please? Perfect. Thank you so much. Good morning, everyone. Good morning to the representatives of the Ministry of Health and all the partners. It is really a great pleasure to join you today and contribute to another
Recording in progress.
From afar. For the World Bank, high-quality primary healthcare, beyond the surely critical role that PHC has in emergencies like COVID-19, is really the cornerstone for health systems to achieve universal health coverage. And also, to build and protect the country's human capital. And this is, I believe, a conviction that we share with the Ministry of Health and with the broader government of North Macedonia. So building on the Astana Declaration, this year, the World Bank has released a flagship report that is called Walking the Talk, Reimagining Primary Healthcare After COVID-19. And this report charts an agenda towards a reimagined and fit-for-purpose PHC. It calls for a significant increase in financing by countries as well as donors, since investments in PHC have shown to yield high returns and promote resilience and sustainability. To reimage a fit-for-purpose PHC, the report identifies 4 high-level structural shifts in how primary healthcare is designed, financed, and delivered, from low to high-quality services that are delivered by multidisciplinary teams to strengthen the range of services and the quality of care, from fragmented care to person-centered integration, in which cohesive primary care teams coordinate care around patients' needs, from inequity to fairness and accountability, in which equitable and efficient PHC delivery fosters and rewards accountability for outcomes, from fragility to resilience, in which primary healthcare teams conduct public health surveillance and outreach, and health sector planning and resource allocation include financial as well as human resource surge capacity. And PHC really needs to reach new levels of performance by focusing on 3 key priorities of action. One is multidisciplinary team-based care, revitalized PHC workforce, and adequate and sustainable financing. So as you can see, those are all principles that the Ministry of Health and all of us partners in North Macedonia have already been striving towards over the past couple of years. But even prior to that, back in 2015, in order to promote better measurement of high-performing PHC, the World Bank, with many other partners represented today, including WHO and UNICEF, joined the Primary Healthcare Performance Initiative. Through this partnership, North Macedonia received additional technical assistance to complete what we call the PHC Vital Signs Profile, to which many of you have in fact contributed directly. The profile provided a comprehensive overview of the country's PHC system and really has elevated North Macedonia as one of the pioneer countries to comprehensively measure their PHC system with this new methodology, which is going to be grounding also the new framework that will be released for measuring PHC by WHO very soon. The profile pointed to the need to increase spending for PHC in an equitable manner to incentivize quality of care, to strengthen PHC-specific competencies of all professionals that need to work together as a team to deliver integrated and comprehensive care to the population throughout the life cycle, and to strengthen governance and quality management infrastructure. So this was one of the many analyses that partners worked on in support to the ministry to provide evidence to inform decisions about primary care reform. But all the assessments reported very consistent findings and pointed towards common way forward, which are the principles that are today included in the PHC flagship report and that are very well embedded in the discussions about reforms and PHC reforms in North Macedonia. So as a follow-up activity to this assessment, the World Bank then started an analytical study on supporting investments in continuity of care for hypertension and diabetes in North Macedonia in collaboration with the Macedonian Medical Association. This is an implementation-focused study to assess the continuum of care for the 2 NCDs to provide additional and more specific evidence and recommendations on how PHC can contribute to an effective management of NCDs. And finally, the World Bank has also recently supported the Ministry of Finance in its effort to prepare a human capital strategy for North Macedonia. So our team worked very, very closely with the 3 human development ministries, health, education, and labor and social policies, to provide succinct, but at the same time comprehensive evidence based on extensive analytical studies that have been conducted in the past couple of years, not just by the World Bank, but by many other partners, including WHO, including the EU, and by other national institutions, as a basis for the Ministry of Finance to develop this strategy. This work, which continues today, will further support, even beyond the Ministry of Health, a stronger health system centered around fit-for-purpose primary health care. And I conclude by reiterating that even after, especially after the wake-up call that COVID-19 was for all of us, the World Bank remains committed to continue working with the Ministry of Health and all of other partners to make fit-for-purpose PHC in North Macedonia a reality for all. Thank you very much.
Thank you, Mrs. Federica Secchi, for your expose. And I will kindly invite Mr. João Breda, Director of the newly established European Center of the World Health Organization for Quality of Care and Patient Safety, to provide information about the work of the center and the possibilities for support in the following 2-year contract for cooperation between the Ministry of Health and the World Health Organization. Please take the floor.
Slides, please. Good morning to you all. I am once again delighted to be here in North Macedonia together with you. It's not my first time in this beautiful room, although today with a super production. Congratulations for that. And it's always a pleasure to be here now in somehow in different functions as the facilitator and, if you allow me, the implementer of this new initiative that WHO Europe is setting up in a neighboring country in Greece and focusing on quality of care and patient safety. But before I go into the conversation of today, I would like to really express our gratitude to the senior officials of the ministry and to commend you for all the great work that you've been doing, for all the great work around this very important issue of delivering health and primary care to your citizens, particularly in these very difficult times that we've been going through basically for 2 years. So my first word goes really to the health professionals in the room and those who've been working and so hard in the context of the Ministry of Health at all levels. And I would also like to commend the minister himself. Also for the colleagues to the World Bank, and appreciate the great support that they are providing to the country. And of course, last but not the least, all of you, and particularly, if you allow me, my great colleague, Dr. Gian Tawili, for her fantastic work. She is well known for being an incredible WHO representative, and her work in North Macedonia speaks for itself. So I don't think I need to talk much about that. So congratulations for that and best wishes for the future as well. So in a couple of minutes, what I would like to do is really to tell you a story of this new initiative that we have in Athens, in Greece. Great support from the Greek government, which is providing resources to the regional director and to the WHO regional office for Europe to establish this new center, this new resource, create these great opportunities around quality of care and patient safety for the entire WHO European region, although with a very, if you allow me, a specific sub-regional focus. So in your country is among probably the top priorities for our office. So those countries that are situated around the Mediterranean basin, the north shore of the Mediterranean and nearby, are really in strategic terms, the countries that we are going to be more focused on, although we will be working for, of course, all the 53 member states at different levels and using different tools. But this is a bit the story I'm bringing you today in a very humble fashion, to say that we have this resource that you can use and you should use, and we are very much willing to work together in terms of ensuring that the health care that we provide to the people we serve is of great quality. And of course, that is central. Everything we should do in healthcare needs to be high quality, but we know that we have a long way to go, and therefore we are here to improve. We have a long story of working around quality in the WHO European region, particularly in the last century, in the 80s and the 90s. But then, I wouldn't say that it went down as a priority, but it was not so much at the top of the agenda. And our regional director is really now trying to recover that and really putting again quality of care at the center, and really the creation of this unique, because it's the only center of its kind in all of WHO, this Center on Quality of Care. And we would like to make it kind of a lighthouse, a place where people look to collect and to get support at the country level, but also in terms of really looking at new ways of doing things, looking at innovation, and therefore we have a very clear vision, and we are very ambitious in what we would like to get to the office in the coming years. So first of all, it's really due to a great support and leadership from the government of Greece, and this is just a photo illustrating last April. So we are a very small baby, if you allow me. We have 6 months. So we are not even walking yet, but we are, you know, on a good path, and we are on the way to really establish something that could make a difference in the region. So there's been a formal launch, and the office is really established in Athens. And we had a very interesting opening event where we presented the vision and the strategy really for the office, which of course is nothing separate in itself. This office is going to contribute to the achievements of the ambition of the European Programme of Work, 2020-2025, which, as you know, is the public health policy, basically, for the entire WHO European region, proposed by our regional directors and adopted by all our countries, including, of course, North Macedonia. Very clearly, our office aims to support this country focus. If you read this policy, it's really about working with and for countries, with a very strong, particularly emphasis on reducing inequalities, therefore leaving no one behind. And also making sure that health authorities, health professionals, you basically, all of us in this room, we get the support that we need, that we are empowered to deliver on our functions and on our obligations. And that support, those resources, we know, are not always there. So we really want to be also the voice of health professionals from the perspective of quality and quality of care. So we believe, and our regional director believes, that health leaders need to be empowered and supported. Then, of course, acknowledging that quality of care, there is no UHC, universal health coverage, without quality, right? So quality of care, sometimes forgotten, needs to be at the center of everything that we are doing if we are to achieve UHC, universal health coverage, leaving no one behind. So we really need to speak loudly and raise our voice with government, with policymakers, with patients and their families, all the stakeholders really need to understand how important this is. And of course, there are certain elements which are absolutely essential. One is, of course, the health workforce. Eventually, if not the most important, one of the most important. That needs to be further developed, that needs to be empowered, that needs to be nurtured in a modern way. And that's really very important. We are living challenging times, and therefore we also need to live up to the challenge, and we need also to transform the way we educate and we generate our workforce as well. So making sure that we can ensure that excellence. And, using new technologies, the digital, the finance to be on its place, the engagement with patients and families, all of that is really very important. WHO has done work globally and at the regional level in these areas. And now we believe that it's time to really work more intensively on quality so that we can achieve this UHC that we all ambition for. So the vision of our office, if I may share with you, and I'm very proud to say that this is almost the first, basically you are the first country. I think it's very symbolic where I'm doing this type of presentation. I've done it for a group of people a couple of times, but for a country is really the first time. And I think delighted to do that, and I'm very proud to be here in North Macedonia talking about this office there based in Athens, not so far from here. So the vision is really it's implementing the European Program of Work, but with a focus on countries, reducing inequalities, but also with my colleague Gian talked about, and also you were talking about the importance of leadership. So we really consider that very important. It's about countries, it's about leadership and innovation. So we want to serve all countries, where we cover from the classic elements of quality to something which is maybe more cutting edge. And we need to do it in tandem and making sure that we promote experiences that are shared between countries. So I think the vision is a good one and very clear. And then we have basically four main pillars, strategic pillars, if I may say. One of them, again, making sure that we support the member states in their national strategies and frameworks. Very strong focus on innovation. Innovation is not always discovering new things and having a new digital tool. It's social innovation, right? Things like social prescription, we were talking about that last night. I mean, there are many innovations which, in a way, it could be only doing it in a different way, right? And that is very important. We would like to identify those innovations and ensure that we can share that with countries and so on. Policy analysis, dialogue is very important as well, and really building networks and alliances, which in terms of quality of care, we believe this is very important. So therefore, our ambition is to cover the full scope of the work around quality of care, if we may say in a continuum. From the essential quality assurance, including patient safety. As you know, patient safety is very high on the agenda, and this office has the overarching ambition to do quality of care, including patient safety. And you know there are global strategies which are very strong at the moment. Moving on to quality improvement, the importance of evidence-based and the importance of science and research to really inform decision-making, to the very critical element of patient experience and their families, to let's say the next frontier around digital, if I may come back, value-based healthcare. So all the continuum, we are there to support you on that and to work with you on this one. We are actually already, if I may come back, doing it. This is the one where I want to be. So again, a bit more detail from development of clinical guidelines to design quality evaluation frameworks, national plans, the use of data for clinical governance, and also in terms of training and capacity building. We are there for you in all of these areas and use us as a resource. We've started our work only with 6 months. Last week, we organized something we call the Meeting of the Minds on Quality of Care. We are very happy that we brought people from all over the world and some of the big minds on quality of care, and we had really very interesting reflections looking at digital, looking at the lessons from COVID in terms of quality, the involvement of patients and their families, the national frameworks, and so on and so forth. It was an incredible meeting. The minutes are going to be available. It's been recorded. If you would like to follow, please do. We can give you the details. It was very refreshing, and it was a brainstorming that is helping us design our paths as well, because we are very humble. We want to do this with the countries and with you, and we want to serve you the best we can. Therefore, we try to bring all the people so that they can guide us in the best direction. We also had in July a summit on mental health, where quality of mental health services, which is very important, was really discussed at very high level. Therefore, we are already moving as we try to solidly establish ourselves in Greece with our team. Of course, we are not the only ones. We are very small here. As you know, you have a regional office in Copenhagen, and I've put you there in the center, right? So there's a lot of resources you can and you should use, and our country office here is really centerpiece to facilitate and to ensure that you have access to all these possibilities and opportunities. For example, if you're talking about health workforce, there's a team based in Copenhagen that can work with you, very dynamic on that area. And you have a series of outposted offices. Our office in Athens, it's outposted. We call them GDOs, geographically dispersed offices, although they have different elements, every one of them. For example, Barcelona here, you see, on health financing, obviously, is very important for the work around quality. But I heard with great pleasure our colleague from the World Bank saying, NCDs, quality on NCDs and primary care in NCDs, this is absolutely essential. You know that NCDs are responsible for 80% of burden of disease in all countries, basically, and therefore we need to do more. You can use the resources, therefore, on the NCD office in Moscow, and when I was in Moscow, I was delighted that we always work very closely together. Again, Greece, but also Almaty, our fantastic center, primary care center in Almaty, which is also a GDO, which obviously is also a great resource. So there are really a constellation of opportunities and options under the leadership of our country office that I hope you can use. This is just an illustration of the Meeting of the Minds, so if you have curiosity, please go there. Leadership is important. What you see here is a regional director, 4 ministers, and a few humble guys from the regional office. But together, we are showing a lot of leadership and that we can really make a difference. This is just from last week in Athens. Thank you very much.
Thank you, Dr. João Breda. We heard the official representatives and their addresses on the reforms in primary healthcare and quality of health services. Now, we start with the working part of the event, discussion with the topic promoting healthcare in North Macedonia, achieving and the view towards a better future. I would like to invite Dr. Tino Marti to be the moderator to this session. You may take the floor.
Thank you, dear Sania. Ladies and gentlemen, it's a pleasure to be with you again in this third forum on primary healthcare. We have heard the different addresses from Jihan, from Joao, from Federica in the World Bank, putting primary healthcare in the center of the reform. And we have started to do some steps, and I would like to stick to the walk, the talk that Federica was referring, and start this roundtable on the next steps of the primary healthcare reform in the country, but taking stock of the progress done so far. So we have organized this roundtable to listen from different stakeholders this progress, and I would like to invite first, Sania from the Ministry of Health to explain the progress done on leadership, political leadership, governance, and legislation change. Thank you, Sania.
This is my function, actually. So my name is Sania Sazdowska, for those of you that do not know me. When you've spent 17 years in an institution, you feel like the host. So each challenge that comes your way, even chairing in some way this conference, it was my great pleasure, and that is why I accepted to manage. But I grew up in this ministry, and I want to give my contribution to improve things for this country. In my presentation, I will speak and give a short overview of the progress of the reform in primary health care from 2018 until today. Just a second. In the Ministry of Health, we know that with support, as I mentioned in my introductory address, that with the support of the WHO and the World Bank, a national reform was initiated for primary health care in 2018. The reform started, and this year, 2018, is the year of assessment and situational analysis. In this year, we did many analyses to see where we are and what the situation is in primary health care in the Republic of North Macedonia. In this year, a new model was proposed for primary health care. In 2019, this is actually the year of vision. Then, in 2019, the first National Forum for Healthcare was held, where the Minister of Health presented the vision for the reform in the primary health care. So that we can support the vision with experience from other countries, a team from the Ministry of Health, the e-health directorate, selected chosen doctors, and the Health Insurance Fund participated in a study visit in Spain, in Catalonia, and in Slovenia, where they saw the reformed models in these countries. In 2019, we defined the action plan for 2020-2021, as well as the need arose to create a supervisory group that will follow or monitor the processes for reforms in primary health care. Pilot site was also determined, a health institution where the reform would be implemented and piloted. 2020 is the year of implementation, when we formed the supervisory group to steer or manage the reform in the PHC. The second national forum was held, where the steps were presented for implementation of the national plan by developing clinical guidelines for the most common chronic diseases, as well as defining the role of the nurse. All of these was watched by the supervisory monitoring group for reforms in primary health care. Of course, there were many challenges throughout the process that we are still facing today, but with great dedication from part of the members of the supervisory group, the implementation steps, even though slow, were realized, and the goals from the action plan were realized as well. And in this occasion, I must point out the great support and dedication towards the implementation of these goals and activities of the key institutions, and that is the Health Insurance Fund and the Chamber of Doctors, And we know that the COVID-19 pandemic additionally pointed out the need that this reform should continue and should be sped up regarding the implementation of the determined goals. In 2021, the efforts were directed towards developing professional tools, technical tools, which were to be implemented and are being implemented in the national context. And also, a pilot municipality was initiated, municipality of Karpoš, to test these tools to monitor the quality of health services. The second slide refers to leadership, governance, and legislation. As we know, the first priority of the Ministry of Health in the past period has been handling the COVID crisis. In response to this crisis, the already started reforms were effectuated and put as a second priority, but this pointed out to us that we need to have strong leadership and engagement of the leading institutions into primary health care, to have more support of the members of the steering committee, to introduce institutional structure for managing products for realization of the reform in primary health care, and also to change the legislation. And now, when it comes to the changes to legislation or amendments to legislation, because if you want for a reform to happen, we need to harmonize and align the legislation. So that includes the laws and bylaws. And here we're talking about amendments to the law on health protection, law on health insurance, and several bylaws. And specifically about making it possible for the chosen GPs to provide services outside of a health institution or within the home of the insured person or in a different public or healthcare institution, to expand the list of health services, which is part of the decisions for work of the chosen GPs, to revise the regulation for specialty programs by including family medicine as part of the specialty programs covered by the country, and changing the criteria according to which this specialty program is awarded. Following steps that I feel we should follow is strengthening the leadership and governance or management of the reform of the primary health care by strengthening institutional capacities, then by forming a national body for implementation of the reforms for primary health care, and this would be a project unit where a mandate would be given to realize the activities, to coordinate and to communicate with all the stakeholders, so that there is an established principle of project management. But of course, the work of this organizational unit should be supervised by the monitoring or supervisory group. Auditing of the steering committee and defining the clear tasks or the jobs, then assessment of the needs for legislation changes, defining the role of the nurse, like monitoring patients, services that can be provided by a nurse. And in the end, to develop an action plan for implementing the changes into the laws and bylaws. Thank you very much for your attention. I'm expecting your questions, a discussion from my presentation, so that you can express what you want to say in the part that is dedicated to this. So thank you.
Thank you very much, dear Sania. Political commitment, governance and legislation are fundamental, but it's also the focus on quality of care, and specifically in the development of clinical protocols for primary health care. And to listen the progress done on this domain, I would like to invite Irina Lucheska from the Health Insurance Fund. Please, Irina, join us.
Distinguished ladies and gentlemen, the primary healthcare protocols have the goal of standardizing the healthcare on the primary level for defined diseases and states. But they will also define the continuum of care from the primary to the tertiary level. They will define a framework of healthcare by the nurse, and they will point out the segment of advising patients. Within the protocols, indicators for quality and evaluation framework will be defined, and they will be implemented in the payment mechanisms. The process of developing the PHC protocols started at the end of 2019 by forming the working groups whose main goal or purpose was to develop and prepare the expert medical content, which further on needs to be harmonized and adapted to the other protocols and processes. Indicators for quality need to be defined, and a form needs to be developed. The so defined protocols are then to be adopted, and the process does not end here. What comes up is promoting the protocols in the primary care teams, primary health care teams, implementing them in the My Appointment system and the mechanisms for payment. And last, but not even remotely least, is what we call informing, education, and communication with the population, which is a process that needs to keep going in continuity. What is the current situation? The protocols for work with children are in the stage of working groups preparement. The asthma and other pulmonary diseases are prepared. Diabetes and hypertension are being defined. Hypothyroiditis is being defined as well. The family planning protocol is being adopted, and the antenatal care protocol is being implemented in Mój Termin or My Appointment. What awaits us in the upcoming period and the goals are that all the protocols during 2022 to be adopted, and in 2023 to be promoted and implemented. What is the content of these protocols? So the protocols includes a screening segment, of course, if it is justified and elaborated, supported by an algorithm. Then comes the diagnostic part, goals of the treatment with defined parameters and values, treatment, monitoring, patient follow-up, measures in uncontrolled specific situation and complications, and this includes referrals to higher level. Protocols are supported with indicators for quality and a form for implementation in Mój Termin and payment mechanisms. And there's an excerpt shown on the background of this slide for such a form. And in the end, remarks for the necessity to change the regulations regarding the positive list and referrals. In the process of development of protocols, so far we have around 80 persons involved in interdisciplinary working groups for protocols and codebooks. They have representatives from institutions from the Ministry of Health, the Electronic Health Directorate and Health Insurance Fund, and also representatives from the professional associations, that is the Chamber of Doctors, doctors from tertiary healthcare, associations of doctors from primary healthcare, and nurses and civil organizations. The process was supported by the international community as well, or is supported, and above all by the WHO that did a thorough analysis of the situation and weaknesses and gave recommendations for future activities. We have support by the Republic of Slovenia by sharing materials and experiences, support from the EU and UNFPA, which assisted the development of capacities for the methodology for developing and implementation of evidence-based medicine, with special support regarding reproductive health. We feel that with persistent and continuous work on developing protocols for primary healthcare, we will come closer to the vision for healthcare that is designed for and around people and not focused on diseases. Thank you.
Thank you very much, Irina. This is a very important step, and I would not say it's a small step, it's a giant step in developing these clinical protocols and getting the agreement of the professional community. Of course, the challenge is to implement them. There are many ways to implement. One of the levers is e-health, and we want to listen from Jacqueline Chagorowska from the e-health directorate at the Ministry of Health, which have been the progress on this rich, full health information system that you have at hand, and that can be very supportive for the future of primary healthcare developments. So I invite Jacqueline to join us in this round table. Thank you.
Good afternoon, everybody. I would like to use this opportunity to welcome you on behalf of the Electronic Health Administration. I will try through my presentation to present the way in which the electronic health participates, provides support to the public health care reform. The COVID crisis has shown us all that without digitalization, it is not possible to make any moves further in all segments of our lives, but especially in the healthcare system. And for us who are part of the electronic health, this was a huge encouragement and opportunity to show how, through different tools that can be implemented in our healthcare system, we will be able to improve the healthcare services for the citizens, but we can also help other institutions to perform their tasks and duties without endangering the lives of their patients. One of the already mentioned, as Mrs. Tavila said, the agility was very important in every segment, but I will also say about our country and the healthcare system in our country, and especially about the electronic system, in view of the fact that we have well-developed electronic healthcare system, which is MOI termin, and the foundation that we had helped us to introduce new tools and to upgrade the existing tools in order to enable for the primary healthcare and for other levels of healthcare more easier and more simple obtaining of all necessary information and enabling the whole operation, everyday operation, to be facilitated in this digital way. I will mention this electronic prescription system, which has been established since the very establishment of the electronic system, but during the COVID crisis, it developed its role because in cooperation with the health insurance fund, this electronic prescription system enabled all the medicines from the positive list to be available online without any need of hard copy or paper-based prescriptions, and without the need of patients to going to the surgeries and healthcare institutions. And after this reform, I hope that we will continue to expand this electronic prescription system with other medicines. With the COVID crisis, part of the modules that we had in MOI termin, we made their reorganization by adding additional modules, thanks to the selfless support of the World Health Organization and the UN agencies present in our country. For example, with the WHO, we developed a module for integrated telemedicine, which allows in the surgery of the general practitioner to schedule a medical examination and through a safe video connection to make the medical examination. This was already developed and implemented in the MOI-Termin system. We are in a phase of completing the testing with the GPs and the specialist physicians, and hopefully by the beginning of following year, we will enable wide use of this option on the MOI-Termin application. This is one very excellent opportunity which have been part of the reforms in order to schedule a medical examination with the general practitioner. This module has already been implemented in MOI-Termin, but unfortunately has not been used yet. We are expecting several changes, maybe organizational changes. We're also examining identifying the needs, whether some bylaws should be implemented as well in order to start using this module on voluntary basis in the beginning. The nurses are, of course, they exist, but through our electronic system, they didn't have any specific role. And through the reforms, we provided our nurses with a special role in our electronic system. We are waiting for the privileges to be defined during the reforms. At this point, I would like to emphasize the module for visiting nurses that we developed in cooperation with UNICEF, and which is already in a testing phase and in training for the users. And we hopefully by the 1st of January, it will be operational, so that the results of the work of the nurses will be able to be seen by the general practitioners. What have been working on during 2020 and 21. We were working on a health intervention that the GPs will be able to perform in their surgeries and to record in their systems. The list of services has already been established and has been used since July 2020, and the list of healthcare interventions has been technically developed. But we are expecting the legislation to support this process and to allow the general practitioners in their surgeries to perform interventions which are mostly performed in the secondary healthcare level. These services have certain codes, and they include certain points that will provide for measurement of the performances of the GPs. The last two slides refer to modules and systems that we expect, together with the other reforms, to be implemented. I will only mention them. So all of these reforms should result in a benchmarking or to introduce measurement of the performances of the general practitioners through all these tools that are available and all the opportunities by the present system, and including with the upgrade of the introduction of the new modules in order to use all these templates that Irina mentioned and make them in an electronic way, and to withdraw from those all the necessary information that we need in order to contribute to monitoring the patient's health in a much more simple way in the surgeries, and also on the regional level and on the level of the whole country. We have already developed a new mobile, which is mobile, who should include the rules for addressing the patients from the general practitioners to the secondary and tertiary healthcare level. And these services, which will be based on the new paths, will provide a more clear picture in terms of when the GP can address the patients to the other levels of healthcare. And the last thing that we mentioned in the dashboard, which will be developed and which will contain all the necessary information that are created in the system and will help monitor the status at the level of surgery, so that every physician will be able to monitor the health status of their patients and to monitor the status on the regional level, and also the status of the whole community and the whole country. These two modules have been already designed, and with the end of the other activities within these working groups that we mentioned before and who are supporting the primary healthcare reform to complete these activities and to get a clear picture and to proceed with their implementation. Thank you very much.
Thank you very much, dear. E-health is important, but in the action plan, besides the different actions that we have heard at national level that are applicable for the whole country, we also foreseen a local implementation demonstration. And one of the first districts, municipalities that were chosen for this local implementation was the Karpush district, and we have the pleasure to have Dr. Kirill Soleski, his family doctor, working in the Bucharesti Polyclinic. So please, Kirill, join us and explain us what did you do, what you are doing in this pilot in Karpush. Thank
you. Добър ден и от мене.
Good afternoon on my side. At the beginning, I would like to welcome you on behalf of all healthcare workers working in the Bucharest in the municipality of Karpush, where this new model will be piloted. In the past several months, we have been working very intensively with the support of the World Health Organization, with Dino Martin, with Jalesko from the WHO office in Almata for the primary health care, and I will try very shortly to present the most important activities that we were able to complete. We worked on a new approach for providing high quality, improving the quality of the primary health care services in the country. The concept of this model that we are proposing is a transition from the traditional to a more comprehensive model for providing quality, improving the quality on the primary healthcare level. We focused on two things. The first thing was to introduce new roles in the existing primary care system, and another thing was the plan to provide a quality, patient safety, and plan for improvement of the quality. What is the model of the primary healthcare at the moment? At the moment, this model is single practice, including per physician and a nurse in one shift. What is the concept of the new model? There are many more people involved because our proposed model and recommendation is to introduce the group practice. Why? Because this is an opportunity for the teams in this group practice to share some space, resources, human resources, and tools which will reduce the costs. Also, the new member, which is the medical administrator, will have the role to work on most of the medical administration, which is currently the task of the nurses and the physicians, and to provide group education of the patients, which is a very important new moment in innovation, which is the creation of the so-called local health board. It's a body that will integrate the healthcare workers from the private and the public sector, but not only from the health sector, but from the other related sectors such as the social work, education, and also it will also involve representative of the patients or representative of certain patient organizations. What will be their role? Their role would be very important in the process of expanding this model on a national level, and it will make all the data that already exists in my termin, it will analyze this data, will define the priorities in the municipality, will set their targets, and to make a plan for measuring the performances in terms of achieving of the goals. In parallel with this, we were working also on the implementation of development of clinical protocols and quality indicators and in mechanism for improvement of the quality. In this short, intensive period of time, we have developed the whole model of the working task of the nurses, description of job description, its functionality, the room where the nurses will provide their services, and the job description of the medical administrator within the group work. We also defined the path of how the patients will be selected within this pilot model, how the appointments will be scheduled with the nurse for medical promotion, who will perform education of certain patients on certain topics. Then what are the possibilities of this model? First of all, this model will lead to improvement of the health outcomes. Why? Because the teams will work with clinical paths and clinical indicators, will have a mechanism to improve the quality, which will all lead to better health outcomes. It will improve also the patient satisfaction. Why? Because the team will also include additional members who will be able to respond to the increasing demands of the patients. The physicians and the nurses will be able to more focus on the medical part of the work, which will increase their satisfaction and will enable them to improve the balance, life and work balance. Because we have to agree that as a result of the COVID, this work and personal life balance has been disturbed, and the new clinical protocols and the new team members will enable most of the healthcare problems to be resolved on a primary level, which means lesser involvement of the secondary and tertiary healthcare level. And the studies have shown that the less the patients are addressed to a higher healthcare level, we have savings in terms of prescriptions of additional drugs. But we also face challenges such as the way how to provide funding for this model and how this model will be implemented within the national system, how this model will be expanded to the national level. Also, another challenge are the human resources, because we are facing a lack of healthcare workers in our country. Also changes that needs to be done in the rules books, in the legislation, so that to enable and to make this model functioning, and the overall digitalization of the primary health care, which is a necessary precondition in order to make this transition from the traditional to the new model of primary health care. Thank you.
To show how the reform is taking shape in Karposh, and that will be the way forward for expanding the model. But nothing is possible without funding, and funding has to be strategically aligned with the goals of the reform. And on this domain, we want to hear from Dr. Igor Nelosky from the Health Insurance Fund, the work done on this domain. Thank you, Igor, to join us.
Thank you, Tino. I would like to greet all of you present here. In order to have a successful implementation of the primary healthcare reform, we need to improve the way of funding of the primary healthcare. This primary healthcare in our country has been organized in two segments. The first segment are the public healthcare institutions or the healthcare homes, and the second segment are the private healthcare institutions or the selected physicians. The current model of funding of the primary healthcare institutions or the selected physicians are the model that was introduced more than 13 years ago, and since then has not been adapted to the happenings and the developments in the society. This model consists of two parts. One depends on the age and the number of the patients, and the second one depends on other targets such as preventive examinations. On this slide, you can see the current and the future improved model that we want to achieve with the reform. Most of the changes refer to the variable part, which is the right one. and its structure, all its components. The changes refer to the monitoring of the number and type of health care services, monitoring the patients with chronic diseases which are in stable condition, performing certain medical procedures and healthcare interventions, performing preventive health examination, and redefining of the role of the nurses. The first segment is recording the healthcare services, which are actually basic services that the selected physician is already providing to his patients or her patients, but now they will have to be recorded in the electronic system by the separate system of codes mentioned by my colleague Jacqueline, which is already introduced in my termin, and since then it should be used. The second segment, it referring to the variable, refers to the patient that already have been diagnosed with certain chronic disease, and these patients should be monitored by that physician and should be controlled in accordance to the adequate protocols explained by my colleague Irina. Each disease will be presented with a variable, with a percentage in the variable part. It will have a separate coefficient for its complexity, depending on the healthcare services that should be provided by the physician. The goals will be defined on an annual level in cooperation with the selected physician, in coordination with the Ministry of Health, and the payment will be made in progressive manner. The health intervention of the third segment, which is the innovation in the variable part, and refer to the medical procedures for which the selected doctor has competencies, premises, and equipment to provide in order to reduce their addressing to the higher level of healthcare level and to expand the primary level services. Indeed, for this intervention, there is in the final phase of development, there's a special system of codes. And in this this system of codes is distributed in 3 levels, and that can be performed by all the 3 physicians, and one part of which can be performed only by medicine specialists. In order to improve this model, we can provide additional incentives for performing certain specific procedures depending on the needs of the health system. The fourth segment of the variable part is not new. It is about preventive goals for early detection of non-communicable diseases, which already exist in the current model, but due to subjective and partly of objective reasons were not implemented, although they have been paid in full. Thus, the role of these preventive roles have been lost in this manner. With the reform, it is envisaged these preventive goals to be defined in the protocols for each of these preventive goals. There will be a separate percentage part in the variable part, and for each of them, there will be a separate code or special weight coefficient, weight factor, depending on the intervention that should be performed in accordance with the health protocols. The same goes for the monitoring and control of the patients with chronic diseases. And these goals will be defined on the annual level in cooperation with the physicians and in coordination with the Ministry of Health, and the payment will be made progressively. As one of the weaknesses or gaps in the primary healthcare system is the administrative overwhelming of the nurses and the physicians. Therefore, the reform model envisages additional remuneration for the additional staff, such as the administrator, who will take over part of the administrative tasks in order to be able to engage the nurses on the healthcare services. And therefore, it is necessary to recognize the nurses with a high education in the system, to provide a separate role of the nurses in the protocols, which will be aimed at following and monitoring the patients with chronic diseases, and for implementation of the preventive goals for preventing disease, early detection of non-communicable diseases and chronic diseases. Reducing of the administrative burden of the physicians and the nurses will enable the larger commitment to the diagnostic and treatment of the patients, in the monitoring of the patients with chronic non-communicable diseases, and in the providing of preventive healthcare examinations. At the end, I would like to emphasize that this proposed model is open for consideration and amendments compared to different models, and in order to include additional stimulations and incentives, such as virtual connection between the doctors and the mutual interconnection, using the shared equipment for diagnosis and treatment of the patient, and horizontal addressing of the patients among the doctors, as well as other modules for engaging nurses and for education of the patients. Thank you.
Thank you very much, Igor. It's really a pleasure to see you all sitting here in front, because this is a very nice sign that this is not a work done alone by some institution, but it's a joint work of the different institutions involved. So thank you very much for being here and showing us the progress done and the next steps. So even in the worst circumstances, some work was done. Of course, a lot of work ahead, but it's reassuring that you are committed to the reform of primary healthcare in North Macedonia. Now it's time for plenary feedback, and feedback means that you have to feedback us back. So I would like to hear from you. If you want to intervene, please raise your hand. We will have some microphone to listen to you. And I personally would like to invite the Dr. Chamber, because Igor did an effort to be here today, so I would like to hear from the Doctor's Chamber, also from the Nurse Association, and if it's possible, also from the Family Medicine Association.
Hello, everybody. My name is Dr. Igor Dadaveski. I'm Vice President for Primary Healthcare in the Chamber of Doctors in Macedonia. I would like to commend this third forum already that has taken place consecutively. Progress has been made, great progress has been made. Some things are already being implemented. For example, the electronic prescription, which arose as a need that maybe was prepared previously, but COVID taught us that we have to implement it, and is a great alleviation, actually, in our work. There is more to be done. We saw ourselves in the table that we are at the very start. And I hope that in some way we will find the strength and the possibility, opportunity to speed things up, maybe to decrease the number of steps, maybe not decrease the number of steps, but make them go through them faster. And our proposal was to use the opportunities and the resources that we already have that are low-hanging fruit, and just to implement them, such as the chronic diseases prescription, to also introduce electronic acute prescription to make it easier to refer to secondary level also through the electronic system, which will decrease our work significantly, will make it easier for nurses to do their job, because our nurses, unfortunately, have turned into either secretaries. I hope that this doesn't insult the nurses, but an administrator that spends 80 or 90% of their time looking at the screen of the computer and trying to get the appointment for a specialist or for a committee, unfortunately. So let's go back to the patients. Let's focus again on the patients. If we manage to make it easier to make appointments, referrals, treatment, getting the right to orthopedic aids, for sick leave, which takes up a lot of our day now, it would be excellent. And in my opinion, in the opinion of my colleagues that I contact all the time, this is something we think that could be implemented the fastest. And of course, all of these protocols and quality indicators that are things that we already do, but as some of the speakers said, it is not visible as we do it now. I will write down what I saw in the patients, but that is where it remains, in the paper file that we have. We do not introduce it into the electronic system so that it can be visible, it can be measurable, and for us to be able to see how far we've come. So once more, I would like to applaud this forum, to thank everyone that has been involved. There are many people involved in the supervisory group in the ministry, and which spent their free time in such an unselfish manner. They're very enthusiastic about this, and I would like for this to continue, if possible, for the process to be sped up and implemented as soon as possible. Thank you.
Igor, any hand raised? Yeah, please. Nurse Association.
My name is Nurse Vilka from the Association of Nurses. I would like to express great gratitude for such an event organized by the office of the WHO, where the results are visible today. They are not maybe finalized, but we can see results. For the first time, we speak about nurses and the importance of nurses. And it's not only a topic of discussion, but is noted and visible, made visible. And when something is made visible, that means it exists. And when it is not noted anywhere, then it doesn't exist and has not been done and achieved. And until now, the role was neglected regarding the specification of the services provided by nurses, and etc. It is to be commended, this introduction of administrator, because the nurse then would be able to dedicate the attention to promotion, to prevention, to rehabilitation of patients. It is great that all interventions will be visible that nurses do, that the role of the nurses in education will be visible. I guess it is planned for such nurses educators to be nurses with high education that have had a specialty in the area that they have selected, and that they will be additionally trained. I don't want to keep the microphone too long. I just want to thank everyone and to congratulate the Office of WHO for making it possible for us to have different types of experts with which we can exchange experiences. So thank you very much.
Would like to provide us feedback of the progress done and next steps.
Hello, everybody. My name is Mikhail Kochurovsky from the Institute for Public Health. I really like this entire process because I participated from the very start in this steering committee. This is good about the administrator, but because I've been working for 30 years in healthcare, I know the levels of healthcare for what we're talking about, the nurses' services, is all very well. But these administrators, I'm afraid that this will turn into a possibility to hire staff that is not a medical worker, that is not. It would be good to give priority to nurses that don't have high education, that only have secondary school. And if there aren't any nurses available for this job, then to give the opportunity for other type of staff that is not medical staff. Let us not make it possible. Okay, I don't want to say something bad, but I don't want for there to be an inflow of non-medical staff into primary health care. I just want to make these positions available for nurses. That's what he's saying.
Прво да ви се представам, јас сум раководител во здравственом Скопје, инаку пилот поликлиниката Букурешт потпаѓа под наши ингеренции. Многу сум задоволна и среќна што Букурешт е избран како пилот за самата реформа во примарната здравствена заштита. Благодарност до Светска здравствена организација, до фондот, до СИТ Министерството за здравство, до приватните наши матични лекари кои што зедоа учество во оваа реформа која што почна 2018-19 година. Би била среќна, пошто сум дел од тимот кој што работи во поликлиника Букурешт, да успееме да го направиме тоа како што треба и да сите чинители бидат задоволни. Може би ме амбициозно да кажам дека гледам позитивна мисла и реакција дека ќе биде секако што треба. Да бидеме оптимисти, да тераме работата до крај, затоа што ако не добиеме завршница, ние фактички како ништо да не сме направиле, а многу луѓе се вклучени и многу темелно се работело на сето ова. Шеднаш благодарност до сите чинители. Среќна сум што сум дел од тимот.
My name is Dr. Svetlana Stojkova. I have my own practice since 2007 in the health facility in Skopje, the Polyclinic Bucharest. I think that until now I've been working responsibly to the benefit of my patients, and I agree with the reforms. But I think that the nurse has been understood, interpreted in a wrong way, and I think that the burden of the nurse has been misdirected. I will speak about my nurses. The two nurses that I work with are very, very responsible, but what we need is secondary staff. If the patient regularly has checkups on a secondary level, I'm talking even on a tertiary level, people that have a bypass, that have stents, they request to go to their doctor that attended them in the tertiary level. And we cannot schedule this. The system does not permit this. And we try to ask the secondary level nurses to schedule an appointment in the tertiary level. And this is impossible, because until we manage to schedule something in the secondary level, then the appointments for tertiary level have already not been available. And even for patients, or for care of others. So this is a problem for 1 or 2 years in the past. There are patients that really have problems, and the nurses are under a terrible pressure because they tell us and we inform each other. So they try to get an appointment. For example, for a private cardiological institution, they put out the appointments on Wednesday at 12, for example. And the nurses are under pressure because the appointments go in a second. They're not available already, and we didn't manage to schedule anything for our patients. So what I want to say is attention needs to be paid on the secondary and tertiary level, not only with GPs on the primary level, because they need to inform and be informed. Let's say from the secondary level that we have referred someone, I feel that if I have referred someone from the secondary level, they should come back to me with the result from the secondary level, and not to get from the secondary level like an order for the GP to send the person for an X-ray, for example. So there needs to be a meeting to expand on the secondary and tertiary level this work. But I think that when the nurse has to schedule something and there is an appointment available, then it's not a problem at all. But the problem is that we have notebooks where we write down patients waiting for appointments. And this is some sort of a break in our work. Because if the appointments were available, we could refer the patient immediately. But this is a big issue that we have to wait for the appointments. Last year, for example, the vaccination was an issue. Last year, we made the appointments for the flu vaccination, and they released these time slots at 10 at night. We did what we can, but this was very difficult. This year, the patients could do it themselves through vaccination.mk, and it was easier. I support that the nurse should be unburdened, but also this pressure should not exist, because we really have to face the fact that on the secondary level, we have very few specialists. And this is where the issue is, where the challenge is. That is why we have this burden. Otherwise, it's not a problem. Education of the population is also needed, because all of these reforms that we're trying to implement here cannot be done without educating the population that they need to schedule an appointment with the GP as well as we schedule for them in the secondary level. I don't know how all of this can be done if the patients and the population are not educated. In this period, we try to separate the positive patients from those that come for other chronic or communicable diseases or non-communicable diseases, and we try to schedule appointments in our practices, because there is one facility. We don't have that many. Some patients respect this, some do not do it. Everyone wants to be checked up. Everyone wants to get an appointment with us. So that is why I think the population definitely needs to be educated, and also to check this issue with the specialists on the secondary level. Thank you very much.
Dr. Dana, you're raising points that are part of the process of walking. When you are walking, you are finding new elements that have to be improved, and they have been echoed also from the Chamber of Doctors. Is there any other question? Otherwise, I would like one question over there.
Okay, let me introduce myself. My name is Professor Dr. Boyan Dimitrov, Chair of the Macedonian Association of Doctors. For those that do not know, this is the oldest professional organization that has more than 63 specialized associations within it. Unfortunately, the number of doctors in our country is dropping due to migrations. Now it's 5,500 doctors of medicine. And I would like to comment and to thank all of those that take care of the primary health care reform, to commend Dr. Jihan Tavila, Dr. Tino Marti, Dr. Joao Breda, our hostess, Sanya, as well as all the rest of the participants, Jacqueline, Igor, Irena, and Dr. Kirill. And, of course, special gratitude to Madam Frederica Secchi from Washington, from the World Bank, who gave us a great opportunity by including us into the study, the project that is very significant for primary health care. And to put it simply, this is, let me explain, what is the effect of the COVID-19 pandemic over the primary health care in our country in 2019 in compared to the care after the pandemic. So whether the patients have been neglected or not. This is a very important factor, not only for the implementation of finances in this aspect, but also in grouping of practices that are supposed to provide this protection. Thank you very much. I think that the steps that are being undertaken for more efficient primary health care are on the right track. And as chair or president of this association, and these members, these 5,500 doctors of medicines, are at your disposal for any future cooperation and study projects. So thank you very much.
Thank you for your kind words. I would like to finish, if there is no more questions, with a final message from each of you, especially looking to the future. What do we have to do to ensure that all the effort that has been done, even if COVID didn't allow to go too far, can be kept and sustained in the next year? So maybe, Sania, you can start.
First, I would like to thank everybody involved in the reform, and I will say that we are very few, but we have a whole team behind us, and I would like to give a round of applause to all the team is involved in the reform. And we wouldn't be able to free from the Ministry of Health to lead this reform if we don't have all the stakeholders behind us and all the foundation, the basis, that is the selected doctors. And these selected doctors always go together with the nurses. I will be brief, and I believe that being an optimist, I said that I have been working in this ministry for such a long time. I have grown up in this ministry from the junior position up to senior position, and I will not leave anything behind, and I will move forward together with all of you in a participative way, in a transparent process to make something, to make some changes, and to leave a mark behind us that will make us all happy and proud. Thank you. What I would like to say is that the primary health care has a huge potential for providing equal approach to the healthcare system for the entire population. The current analysis have shown large gaps and inequalities in this approach, and all the healthcare workers involved in the primary healthcare, it is the first healthcare system that will enable the equality of the approach to the healthcare services. Maybe we'll not able to achieve this tomorrow or the day after tomorrow, but a time will come when the primary healthcare system will be the holder, the principal holder for providing patients with their health services, and most of these services would be able to be implemented on a primary healthcare level with appropriate quality and with quality that will improve the health of our population. I think that we can exert our maximum efforts and give more than we have given before, and we should believe in ourselves. Thank you.
Shakina.
My final address on the part of the electronic health system. I would say that Macedonia is already recognized as a country with a highly developed electronic health system, such as the My Appointment. We are trying to follow, not only to follow, but to challenge the reforms at every level of the healthcare system, to witness all the achievements in the healthcare system. And what we are all striving for, that this reform is not possible without the digital healthcare system. So all these steps, we will try to monitor all these steps and to implement them in the national healthcare system in the best possible way in order to be more accessible and easier to access by all the beneficiaries. And one of the deficiencies of our system is maybe to enable a secondary use of the data, because only if we analyze this data, we can move forward and we can develop analysis, recommendations, we can draw conclusions and provide suggestions on the way to move forward, not only in this reform, but in our everyday work on all healthcare workers and the whole healthcare system. Thank you.
Kirill, you want to give us your final thought?
Yeah. Промените
The changes are already happening. The changes are happening because in the center of these changes, we put the patients. Because COVID-19 has taught us that all of us from the different sectors who are working on paving this path, and eventually we can get the role of a patient. When we are patient, we always want to get a high quality level healthcare services. Thank you.
Close this roundtable, Igor, please.
Thank you.
I will add to the conversation that I had 2 days ago at the workshop, at which my colleague Karina mentioned that the study visits that we had in other countries enable us to have a different perspective of the way how the health insurance fund has been operating. From the other countries, we learned that the health insurance fund is the representative of the insured persons, and it manages their funds that they have paid for health insurance or for providing health care. In that regard, I can confirm that the health insurance fund will be included in these reforms, and these initiated reforms of the primary health care, and I'm certain that it will not stop with these reforms will not stop with the primary health care, because there are present problems on the secondary and tertiary level. So therefore, I believe and I hope that in the future we'll have enough strength to become involved in the resolving of other problems in the healthcare system. Thank you.
This we can close this roundtable and move for the next steps and conclusions. But I want to thank again all the presenters, thank for the feedback, and hope to see you again soon.
It's me again. Dear all, thank you for your active participation, for the offered creative solutions, for your deliberations, presentations, and for your questions. About the final recap of our conference, I would like to invite Mr. Bojan Boškovský, representative from the Ministry of Health, and on behalf of the Minister of Health, Federica Secchi from the World Bank, and Dr. Jihan Tavila, representative of the WHO office to Skopje. Thank you, Sanya. I tried to make some notes, and I would like to briefly say what I think about all these things. I'll have to go back to 2018 when we talked for the first time about the primary health care. And honestly, my impression was that we didn't know what our direction should be. We had a lot of ideas, contemplations that we need more money to be invested and so on, but the model and the way, how to treat the patient, nobody discussed about this. Now I have the impression that we are all on the same page. We know where we are going. We all agree that the changes are happening. And I agree, maybe not with the desired dynamics. Maybe these changes should happen more in a more fast manner. When I started to discuss about primary health care, mostly I hear from people, no, this cannot be possible. And this is in our nature. And often maybe myself are sometimes saying, no, this is not possible. But please do not forget, if it's not possible for us personally, that doesn't mean for a group of people or for somebody else, this is not possible. We should never start from our own opinion that something is not possible, it cannot happen, and to make this a barrier for future actions. I think that the changes can happen and should happen and will happen. For the first time, we are discussing the quality of the services, the protocols, the standardization of the healthcare services. All of us working in the health sector, we know that regardless of how different we are, We are following evidence-based medicine, which offers more quality, better quality, and more and better health outcomes. For the first time, we are discussing the quality of services in the primary health care. Some people say this cannot be done on the level of primary health care. They're not the physicians on the primary health care are not educated enough. But this is not true. The context is such that we do not allow them to be more engaged. For example, the patients should go to the secondary specialist level in order to continue with that therapy, and some of them do not want to go to the tertiary level to leave their work and to finish this treatment earlier. So I believe that at this point, this context is something that that limits the patients and the physicians. For the first time, we are talking about the nurses. When I started as a specialist doctor, so it was a blasphemy for a nurse to prescribe a medicine or to make a referral. Today, we can see that the physicians without the nurses cannot function. Not to perform the administrative work, but to help the physicians and with the education of the patients, to contribute the patients to have more, to gain more knowledge, without making additional burden on the physicians, and to leave the treatment to the physicians and not to overburden with administrative work. And sometimes the nurses can overtake some of this work, such as seeing the results of the patient and so on. For the first time, we are talking about the measurement of the performances of the quality of the services. One American manager or director of a company said that if you can't measure it, you can't manage it. And that's true. If you can't measure and if you can't use the data, we cannot manage the process further. We will not be identify the problem. Therefore, the measurement of the quality of the services is very important, not to sanction the physicians or to sanction ourselves, but on the contrary, to be able to see what are our gaps and weaknesses and to be able to move forward. And this is why these quality indicators are very important, that we all agree on this issue, that they are very important. Is this the best model? Somebody will say this is not possible, it is an utopia or so on. There is no such thing as a best model. There is no best model. The model is what we will create and that we will resolve our problems. We are talking that something is impossible. What Kirill mentioned as a concept, maybe at the moment it's not possible, but we can see where we want to go, what we want to reach. If we don't work on it, we will never achieve the target. So it is not a reform just to make a new law and to do nothing with the following 15 years. If you don't change your light bulbs in your home for 15 years, your home will be in dark. So we should see all this process, all this system, to see all this vision, not tomorrow, but for the next 10 years, and to make our way forward. And what is the final ultimate goal? It is to improve the health status of the patients. This cannot be done by the hospitals or the tertiary level, but only by the primary health care level. To have a healthier population and to be certain and to be able to measure the status of the patients. Now we know that non-communicable diseases are the major one factor for the death rates of the patients, but we cannot measure whether with their treatment we are improving their status or we are deteriorating their status. We have not available information about their status. So at the end, I would like to say that it is very important those quality indicators or other goals are not the commandments given by God, but they should be changeable depending on what we are trying to achieve. Today, the goal is to handle the COVID. In 2 years' time, it will be to handle some other disease. COVID or not COVID, we have the services. Whether they are efficient or quality and good, that's what we should be interested in now. The COVID has additionally increased the demand for those services, and it has showed us that the people when back in 2018 thought that something is not possible, now these people can see that some of the activities have already been implemented. So this shows that the activities are possible, and we should all together see this in a foreseeable future. If we are not working, we will never reach our goals. One more thing that the former Minister of Health mentioned of the Croatia, Siniša Varga, which had left a large impression on me, is that changes in the health is like rolling a balls on a river in the opposite flow. So if you stop, then you're regressing for 10 meters. So we cannot do nothing and then continue with the process after 2 or 10 years. I'm glad that we're on the same page and that we have arrived at a concept and a model that will be very fruitful in the future. Thank you for your attention, and see you on some other event. Thank you, Bojan. I would like to invite Federica Secchi, representative of World Bank.
Thank you very much, Sonia. Thank you very much to everyone who have contributed to today's discussion. From our perspective, I think it is very important to recognize that changes are happening and that quality of care is really being put at the center of the system in North Macedonia. Care that is person-centered, comprehensive, coordinated, provided with continuity across all levels of care and throughout the life cycle. And I also wanted to point out that often countries think that they have to choose between efficiency and quality. And there is really no trade-off between quality and efficiency. A low quality system is highly inefficient and generates a lot of waste. It is also remarkable that progress has been made on many fronts and that the country is approaching the reform in a very comprehensive way. Guidelines or protocols are essential, but quality of care goes beyond service delivery. So it needs to permeate the full chain, from the system level determinants to the outcomes. So governance, financing and incentives, leadership, social accountability, regulatory changes are all as important as equal access to care, population health management, strong team-based organization. And two issues for me are really important that I've heard also coming up today. One is trust between all the professionals that work in PHC and across the levels of care, and trust between the patients and the health system, and especially with their primary healthcare providers, which are their first point of access to the health system. And the second point is the aspect of monitoring and feedback. And here digitalization is very important, which really need to be built into the system to enable continuous learning. The last point that I wanted to make is that it is really important that all the stakeholders keep working together to solve all the challenges that will happen along the way during implementation, so that the vision is fully realized. It's a long-term process, and we are all here to support that. And therefore, congratulations to everyone who has contributed to this process. But I just wanted to end on a call for even more urgency. Emergencies are really a wake-up call. So let's try to turn this crisis into an opportunity and move even faster in the implementation of the reform. Thank you very much.
Thank you, Federica. Now I would like to invite Dr. Jihan Tavila to give her final remark.
Frankly, I'm very, very inspired. It's very difficult to add words to what I have seen today. One thing for sure, and it was said very eloquently by Mr. Bojan, by Federica also, that the reform is set. There is no turning back. But the reform is what we make out of it. It is not something predefined. It is something that relates to your way of work. And we have heard Dr. Svetlana very nicely saying that we have issues there. These are the details that makes everything a little bit blurry. But those details can be addressed by you, because you also have the solution. You know where you're going and you know what you want. So I only invite you to show your influence. Be present. If you are not present as these discussions are happening, you will lose a lot of what makes a difference for you as a service provider and for your patients. Now, Irina said something very, 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 very nice. I mean, I want to congratulate you. Irina works for the insurance fund. It's a fund. It's about money and transactions and blah, blah. But Irina is saying, you have to put the patient in the center. We are the advocates of the patients. We need the quality of care. We need you to be satisfied, and we need the patient as well to be satisfied. And I think this is a good lesson learned and a takeaway to take with us and to say how we can strike the balance. And I was very impressed also by Dr. Dimitrov, because he said, our doctors are at disposal of this process. He's talking about 5,000 doctors. A huge army to make a change. We're not alone. It's not only the PHC committee that is here. It's everybody who can make a change. Change happens from within. I remember this as well. Sometimes there are words that go into your brain. Like Gandhi. Gandhi was saying, you want a change? Change comes from within. Contribute. Say what you have in your mind. Another issue I picked up, and it's not only Boyande who picks up a lot of things, I do as well. So another issue that I've picked up is the issue of the workforce. I mean, we cannot hide behind anymore. Please, whoever is the Minister of Health, Ministry of Health has to face the issue, has to introduce planning, has to introduce long-term vision, has to keep the doctors in the country. We need to retain our doctors. Since I came to this country, I feel safe if anything happens to me. The question is why? Because you have very good physicians, and you have to retain them. You can only retain them not only by finance and remuneration, because there is no end to that, but you can retain them by proper conditions of work, by understanding how to relieve the doctor from administration, from unnecessary waste of time, how to give the doctor a proper time to relax, to take vacation without losing the practice. So that is extremely important. And to do that, we need to use all our healthcare workers, not only doctors. We need to see the nurse being able to provide all what she has learned or he has learned. Not to say gender issues in front of my colleague of UNICEF, so I have to be very careful. Another elephant in the room, positive list. Come on, guys. How difficult it can be. How difficult it can be. You have to make a positive list that is relevant to what the patients are suffering from, non-communicable disease. So this should be priority for you to go on this. And this is where all the out-of-pocket money is going, into medicines that are bought by the patient directly, because they cannot wait to have a referral and to come back and to go and come and go. So this is extremely important. E-health, you have done a great job. Really, congratulations. And also the insurance fund. I mean, the tactile things, the things that really are changing. but it's not enough. It's truly not enough. You have the potential to also make a proper patient interface. I go back to the patient. If we focus on the patient, we find better solution. If we focus on ourselves, we will not see beyond ourselves. So patients are extremely important, and we have to see how to link and integrate. When we say integrated care, and I have also heard it from your presentation, it includes the social aspects. And I'm glad that we have municipalities who are willing to come to this partnership. It's very important to get the community element, how to talk with, how to work. The persons are a whole. It's not like when they are with you, they are patients, and then when they go home, they are fathers. It's one person. And we need to start looking at how to balance, how to bring in the social issues, especially for the vulnerable groups. And it's not a waste of time. It is something that builds up as you are building your primary healthcare system. So I just want to really recognize all the efforts who have gone into what you are building. Mind you, the process is not easy. You are doing system issues. We are not just buying a procurement of an equipment and putting it in the facility, and we are not building just walls. We are changing the way we work, at the same time changing the way people think and feel about the work. And this type of change not only required efforts, it requires patience. It requires that we listen to the different people who are involved. I very much liked what Dr. Svetlana has said, because she said, we have issues with referral, and this is where the integration has to go, to really link. Think of it as a system and not as a facility and a service to be given. Otherwise, we'll not make a change. So I want really to thank everybody around this table who have contributed to where we are today. I have also a request, which is you have a great thing going on, which is the PHC reform. North Macedonia is probably the only country in the Western Balkan who is rethinking the primary health care and how to make it better. You have inherited a very difficult and heavy system, and that system is no longer relevant, and you need to make this move. Each one of us should contribute. So, having said that, what I can conclude, you have the vision, yes? You have the vision? Can I hear a clap for the vision? Okay. You have the plan. These people know what they're doing, and they are consulting with you. We need more consultation and transparency, as you have rightly said. So, a clap for the plan. We have the partners. You have seen the whole of World Bank. I think it is nighttime at that place, and they are with us. And they have been with you. They have brought the resources. You have WHO with you all the time. We are almost in the same group, the same team with you. So use whatever you have seen and go forward. And remember, it is about how you are going to make a change in the lives of people. Yes? Again, our business is making the lives of people better and healthier. Don't forget this. So this is where we want to go. I finally want to say that it has been a privilege for me personally. This is a personal note. That is going to be almost my last meeting with all of you, because I will be reassigned to a new place, and I will carry Skopje, North Macedonia, Macedonians in my heart. I will carry all the lessons that I have learned from you. I will carry your hospitality and your niceness and the way you have received me as one of you with me. So I will end it with a farewell, and I hope that our roads will cross again, because this is a small world. So thank you very much for everything. And I will be watching you from Yerevan, Armenia. Be careful. Thank you. I think on this, I give you the floor.
Thank you for the precise and very relevant conclusion to today's discussion. So, distinguished participants, dear guests, we would like to share the success with you from the pleasure with you for the successful conference, with the hope that we remain motivated to work in the future on improving the situation in primary healthcare in Macedonia. Thank you to all the representatives, all the panelists, all the discussions, all the guests that set aside a chunk of their time to participate in our event with their attention. And it is our pleasure and honor to invite all of you to join us to a joint lunch served in the restaurant. Thank you.